Hello, my name is Dr. Lunalux. I'll be your doctor today.
Nice to meet you, Lunalux.
Welcome to my practice. I see here that we have 1 p.m. appointment for a shoulder joint examination. Can you please confirm with me your first and last names and date of birth?
Kat Clausen,
Kat.
January 1st, 1995.
Excellent. Okay, Kat. So I see here that I have the right chart. Can you please tell me a little bit about what brings you in today?
So I'm having a lot of trouble with my shoulder. It's been really sore ever since I was picking up a box and I was trying to put it above myself onto another shelf.
Okay.
And when I was lifting it up, I heard a crack.
Okay.
Just a couple of days ago. And ever since then, it's been very inflamed and just really sore.
Okay, so a couple of days ago, and on a scale of 1 to 10, how would you rate your pain?
I would definitely give it like an 8.
An 8, okay. And have you felt any sharp shooting pains?
Yes, a lot of that.
Okay. And have you tried any ice packs or cold packs in the area?
I have a heating pad that I've been using, but I don't know if I'm supposed to be using heat or if I should be using an ice pack.
Okay. So you tried a heat pack. Have you tried an ice pack as well?
I have not, no.
Okay. And did the heating pad help in any way?
Yes, I felt like it did help, but not long term. It's just a short term relief.
Yeah, for sure. And have you taken any ibuprofen or over-the-counter pain medication?
I've been taking ibuprofen every day, yeah.
Okay. Do you happen to remember how many milligrams were you taking?
Yes, I was taking 200 milligrams and 3 pills each time, so 600 milligrams at once. And I was taking it every 4 hours since I was in so much pain.
I understand, okay. And are you on any medication other than the pain medication you mentioned?
No, I'm not currently on any medication now.
Okay. Have you been sick recently or pretty healthy overall?
I've been pretty healthy, yeah.
Okay. So I'm definitely going to take a look and do a very thorough examination of your shoulder joint and see, what's going on with it, and we can come up with a treatment plan together. I'll also do a massage to see if we can, help you alleviate a little bit of the pain that you're feeling.
Thank you so much.
Yeah, of course, I'm happy that you came to see me. I'm gonna quickly sanitize my hands. I'll put on my gloves. I'll begin by taking your vital signs, and then we'll begin the shoulder joint exam.
Thank you.
And has the pain interfered in any way with you being able to, go about your daily work, do your job?
Definitely. I don't really have a very hard job physically, but I do type a lot.
Okay.
I work in an office, and I find that stresses my shoulder out.
For sure, yes.
And it sort of just goes all the way down.
Okay, so I'm gonna see how we can help you today.
Thank you.
Of course. I'll start off by listening to your heart and your lungs and take a record of your vital signs. Just breathe normally for me. I'm gonna listen to your heart. So I'm not hearing any murmurs or anything abnormal. Hearing S1 and S2. Not hearing S3 and S4. Indicating that there is no sign of heart failure. I'm going to go ahead and listen with the bell side as well. So normal sounds coming from your heart, which is a very good sign. I'm gonna go ahead and listen to your lungs as well. Deep breath in and out. Deep breath in and out. In and out. In. So no signs of pneumonia, any infiltrates, no crackling. I'm hearing normal sounds coming from your lungs. Okay, so that's very good. It's going to give me a good baseline to compare any future assessments against. Okay, I'm going to go ahead and take your temperature. This is going to go over your forehead and behind your ear. Right here, 99.1. That's good. You do not have a fever. Going to go ahead and check your heart rate and oxygenation. Just relax for me. Okay, 98% oxygenation, 85 beats per minute, which indicates that you're very relaxed. So all within normal parameters. Okay, I'm going to go ahead and check the pulse on your arms, right here over your wrists, and make sure that I compare one against the other and that they're synchronized. Okay, feeling about 75 beats per minute, which is consistent with what the oximeter showed. I'm going to go ahead and check the pulse over on your neck as well. Not hyperdynamic, nor weak or thready, which is a very good sign. Okay, next up I'm going to go ahead and start the shoulder joint exam. I'll be just doing a visual inspection first to just make sure I'm not missing any obvious external signs. Not seeing any redness. Is this the area that hurts right here?
Yes, that's exactly where it hurts.
Okay. So not seeing any external signs of any lesions. I'm going to go ahead and move the strap away. Okay. No bruises or anything of the sort. And just comparing it to the other shoulder, I do see a little bit of an inflammation right here. Does it hurt when I'm just gently tapping like this?
It is definitely sensitive.
Okay. Any pain over in your arm right here?
No, not as much.
Okay, so no visible signs of anything concerning. Just a little bit more inflamed than the other one. Okay, I'm going to go ahead and perform a very light palpation to just better localize the pain in your shoulder joint. Okay, you can just stop me if you feel any pain.
Right there.
Right here. Okay, I'll be very gentle here. Any pain here?
No, it's more of like a 3 compared to like an 8.
Okay. Any pain when I press onto your shoulder joints?
I would say a 2.
2. Okay. Okay, just feeling above your clavicle. Any pain here?
And no pain there.
Okay. Any pain right here?
Just a little tight, but I don't feel pain.
Okay. Touching your scapula in the back. Any pain right here?
No pain there.
Very good. Okay. So this is definitely could be the tendon. The rotator cuff could have been damaged while you're lifting up the box, which could have given you a slight tendonitis over here. Okay, I'm going to go ahead and gently tap on your clavicle and your humerus bone, just to check the integrity of the bones. Let me know if you feel any pain whatsoever.
No.
How about right here?
No.
Any pain here?
No.
Okay, let's check your humerus bone. Any pain there?
Definitely tender.
Tender, okay. How about right here?
Definitely. A little bit, yeah.
On a scale of 1 to 10.
4.
Okay, let's go ahead and take some measurements before we proceed with the examination. I'm going to just make a record of what I'm seeing today. And over your clavicle, 1, 6, 9, 4. Okay, and around your biceps. 1, 3, 5, 9, 7. Okay, and across your scapula in the back, 8, 1, 9, laterally and longitudinally, 7, 8, 1, 5, 3. Okay, and across your shoulder from one end to the other, 7. Okay, let me just take a note of these. And these measurements will allow us to make a comparison when you come back and see me in about 2 weeks to make sure that the inflammation has decreased. Okay, next up I'd like to check the nerve innervations in your shoulder and make sure that they're still functioning as expected. Can you please tell me if you feel this?
Yes.
Okay, how about this over your clavicle?
Yes.
Very good. And this over your neck and your shoulder.
Yes.
Very good. And how about the same in the back?
Yes.
Okay. So I'll be touching you with 2 different types of textures. One of them is fluffy and dull, the other one is sharp and pointy. Close your eyes and let me know which one I'm tapping you in.
Sharp.
Very good.
Dull.
Excellent.
Sharp.
Very good.
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, that's very good. Let's check your sensitivity to cold as well. Close your eyes and let me know if you feel this.
Yes.
Okay, that's good.
Yes.
Very good.
On my chest.
Very good.
Down my arm.
Excellent. Next up, I'll be touching you with a very different texture. It's very tantalizing. You should be feeling it all throughout your skin as I'm touching you. If you feel any loss of sensation, let me know. You should be feeling a very pleasant sensation. Any loss of sensation right there? Or is it continuous?
It is continuous.
Very good. Any sharp shooting pain while I'm doing this?
No.
And how about in the back? Okay, very good, cat. Alright, let me just take a couple of notes of what I saw. So no loss of sensations in your shoulder, skin. Okay, next up, let's do a couple of range of motions, which is going to allow me to better assess your damage here and determine the right diagnosis. If you could please hold your hand like this next to your body. Do you feel any pain in this position?
I would say a 1.
A 1, okay. If you could please move your hand forward. Any pain right here?
A 1.
A 1, okay, that's very good. Let's try hyperextension next. I'm going to move your hand backwards. Let me know if you feel any pain.
I would say a 5.
A 5, okay. Now can you do the same and hyperextend your arm backwards on your own? Okay. On a scale of 1 to 10, how painful was that?
It was a little bit more painful when I was doing it on my own.
Okay.
Say number 6.
Number 6. Alright, let's try abduction next. I'm going to move your arm laterally. Just let it loose for me. Any pain right here?
I would say a 5.
A 5. Okay, can you do the same on your own? Bring it up for me as far as it goes without being too painful. Okay, that is very good. On a scale of 1 to 10, how painful was that?
It was, I would say a 4. Not as painful as going backwards.
Alright, let's try crossbody abduction next. I'm going to move your arm across your body. Any pain right there?
Yeah, definitely.
Okay. Can you do it on your own as well and let me know how painful is that? That's good.
Thank you. Yeah, say a 6.
A 6, okay. So hyperextension and crossbody abduction are the two most painful movements. Alright, and finally let's try internal rotation. Can you please bring your arm like this? Does this hurt?
A little, yeah.
Okay, can you rotate it inwards and outwards? Does this hurt?
That's probably the most painful, yeah. I'd say that's like a 9.
Oh, okay. That is very good. You can lower your hand. So internal rotation was a 9. Okay. And can you move your thumb up for me and try to put it behind your back, right? Like this. Is that possible? That's very
As far
good.
as I can go, yeah.
Any pain right there?
Yeah, definitely. I would say a 4.
4. Okay, so it definitely looks like the rotator cuff could have been damaged, which gave you a slight tendonitis. I'm going to go ahead and use an acupressure tool, mark the bony prominences of your bones, and then use the electric trigger point stimulator tool that's going to create a vibration, send it all throughout your body and hopefully relax the muscles.
That sounds really good.
Okay,
Thank you.
that should help. Okay, I'm going to go ahead and mark the bony prominences of your clavicle here and your shoulder joint. Don't worry, this is water soluble, it's going to come off. Okay, and next up, I'm using the trigger point stimulator to send a very harmless vibration and hopefully relax your muscles. Okay, so that should hopefully relax you a little bit. Next up, what I'm going to do is I'm going to use a tuning fork and I will strike it and cause a vibration and place it on the bony prominences that I just marked. Let me know if you feel the sensation and then when it stops. Do you feel this?
Yes. It stopped.
Okay, very good. Do you feel this?
Yes. It stopped.
Very good. Do you feel this?
Mm-hmm. It stopped.
Excellent.
It stopped.
Very good. And one last time, do you feel this?
Yes. It stopped.
Excellent. So there's definitely no loss of sensitivity, no nerves were damaged during your accident, which is a very good sign. I'm going to go ahead and perform a very light massage and bring some energy flowing into your rotator cuff and your shoulder joint, and hopefully that's going to relax you and allow this area to heal.
Thank you.
Okay, this is just some massage oil. I'm going to just gently press a little bit here and here. Okay, first up I'll just be using my hands. Does this feel good?
Yes, thank you.
Okay. I'll be very gentle around this area. And I'll also use my massage tool to stimulate the blood flow towards the damaged area where there is a slight tendonitis happening. Okay, so this should help relieve a little bit of the pain. Going to press gently down on your scapula in the back. Any pain right here?
No, it feels really good.
Okay, so I can go a little bit deeper. Okay. Okay. And let's go ahead and clean up the markings that I did. There, that's all gone now. So hopefully your shoulder joint feels a little bit better now. I'm going to go ahead and take just a quick summary of what we did today. So definitely what I think happened was that your rotator cuff was damaged, a slight tendonitis, could be due to, tendon, partial damage, definitely not a complete tear. You would be in a much bigger pain if that happened. I'm going to recommend that you immobilize the arm, that you definitely don't carry any heavy objects, no lifting boxes, no housework. Just try to keep your right arm as immobile as possible. You can continue taking the ibuprofen for the pain. A hot or a cold patch should help if you place it right here in the back. But other than that, not much you can do. I hope the massage and the acupressure tool helped a little bit.
It really did. It actually feels so much better. Thank you so much.
Okay, I'm happy that I was able to help you. To come back and see me in 2 to 3 weeks for a recheck. But other than that, I hope it's gonna get better soon.
Thank you.